What happens to the body of a 60-year-old man when he stops masturbating? This question touches on an important but often overlooked aspect of men's health, especially for those in their later years. Sexual health remains a vital component of overall well-being throughout life, not just during youth. For men over 55, understanding how sexual activity affects physical health becomes increasingly relevant as bodies change with age. The prostate, testosterone levels, cardiovascular system, and even mental health are all connected to sexual function and activity in ways many might not realize. Let's explore the physical changes that can occur when an older man stops masturbating completely based on what medical science tells us. First, there's often a gradual decrease in testosterone production. While aging naturally lowers testosterone levels, regular sexual activity actually helps maintain healthy hormone production. When masturbation stops, this beneficial stimulation decreases, potentially accelerating the drop in testosterone. Lower testosterone levels frequently lead to decreased energy, reduced muscle tone, increased body fat, and diminished motivation. Many men notice these changes but don't connect them to changes in their sexual activity patterns. Blood circulation to the genital area may also decrease significantly. Regular masturbation increases blood flow to the penis and surrounding tissues, keeping them healthy and functional. Without this regular flow, the blood vessels can become less elastic over time. Think of it like exercise for the genital region. Without regular workouts, the tissues don't receive as much oxygen and nutrients. This reduced circulation can contribute to erectile difficulties, as the ability to achieve and maintain erections depends heavily on good blood flow. The old saying, "use it or lose it," has some truth when it comes to erectile function in older men. The prostate gland is particularly affected by changes in sexual activity. This walnut-sized gland produces fluid that makes up a significant portion of semen and plays a crucial role in reproductive health. Regular ejaculation helps flush prostatic fluid from the ducts of the prostate gland. When masturbation stops, this natural flushing mechanism occurs less frequently. This can lead to a buildup of prostatic fluid, potentially causing discomfort or swelling. Some research suggests that men who ejaculate more frequently throughout adult life have a lower risk of prostate problems, including benign prostatic hyperplasia, a common condition in older men that causes urinary difficulties. Sleep quality and stress levels may also be affected. Masturbation naturally releases endorphins and other feel-good hormones that reduce stress and promote relaxation. These hormones help regulate sleep patterns and mood. Without this natural release mechanism, some men might experience increased stress, more difficult sleep, or subtle changes in mood regulation. For men over 60, good sleep becomes increasingly important for cognitive function, immune health, and overall vitality. The immune system can also be affected when a man in his 60s stops masturbating. Research shows that sexual activity, including masturbation, helps boost immune function by increasing the production of certain antibodies. These antibodies help fight off common illnesses and infections. Without regular sexual activity, this natural boost to immunity may decrease, leaving some men more open to seasonal illnesses. This becomes especially important for men over 60, as the immune system naturally weakens with age. Cardiovascular health is another area that can see changes. Sexual activity, including masturbation, counts as a form of light physical activity. It raises the heart rate, improves blood flow, and burns calories, about the same as walking up a flight or two of stairs. When this regular form of exercise stops, there's a small but real loss of these heart-healthy benefits. For men with existing heart concerns, this loss might be more noticeable. Have you ever noticed how your heartbeat picks up during sexual excitement? That's actually giving your heart a gentle workout. The brain and body connection through hormones can shift too. Regular sexual activity helps balance hormone levels that affect not just sex drive, but also mood and energy. Dopamine and oxytocin released during sexual activity and orgasm support feelings of happiness and connection. Without these regular hormone releases, some men report feeling less motivated or slightly lower in mood. The brain's reward pathways that respond to sexual pleasure need regular activation to maintain their sensitivity. Let's look at some science-based benefits of regular masturbation for men over 60. First, it helps keep testosterone levels more stable. While nothing can completely stop age-related hormone changes, sexual activity signals the body to maintain hormone production. Men who stay sexually active often report feeling more energetic and having better muscle tone than those who don't. Regular ejaculation appears to support prostate health. Studies tracking thousands of men found that those who ejaculated more frequently throughout adulthood had fewer prostate problems later in life. For men already in their 60s, continuing this habit may help manage existing prostate enlargement and reduce discomfort. Masturbation helps maintain sexual function overall. The penis, like any body part, works better with regular use. Blood vessels stay more flexible, nerves remain more sensitive, and tissues maintain better health when they receive regular blood flow. Men who continue masturbating often find it easier to achieve and maintain erections when they want them, compared to men who stop completely. Sleep quality often improves with regular sexual release. The hormones released during orgasm naturally promote relaxation and sleepiness. For older men who struggle with sleep problems, this natural sleep aid can be helpful without the side effects of medication. Mental health benefits from regular sexual activity shouldn't be overlooked. For men in their 60s and beyond, masturbation offers a healthy outlet for sexual needs and helps maintain a positive body image. Many older men report that staying sexually active helps them feel more confident and connected to their bodies as they age. This can be especially helpful when dealing with other age-related changes that might affect self-image. Pain relief is another unexpected benefit. The release of endorphins during orgasm acts as a natural pain reliever. For men dealing with joint pain, headaches, or other common discomforts of aging, masturbation can provide temporary but real relief. These natural painkillers work similarly to mild pain medications, but without any side effects or drug interactions. Regular sexual activity also helps keep the pelvic floor muscles in good shape. These muscles support bladder control and sexual function. Like any muscles, they stay stronger with regular use. Men who maintain sexual activity often have better pelvic floor strength, which can help prevent or improve mild urinary incontinence, a common concern for older men, especially after prostate treatments. Now let's clear up some common myths about masturbation for older men. First, there's the outdated idea that sexual desire naturally and completely ends with age. This simply isn't true. While desire may change or lessen somewhat, most healthy men continue to have sexual feelings well into their 80s and beyond. Stopping masturbation because of the belief that it's no longer age-appropriate can actually speed up sexual decline rather than being natural. Hit the subscribe button if you appreciate health advice. It helps us create more content you can use. Another myth is that ejaculation somehow drains a man's energy or strength. This old idea has no basis in science. In fact, the opposite is often true. Regular sexual activity helps maintain hormone balance that supports energy levels. Many men find that rather than making them tired, staying sexually active helps them feel more energetic overall. Some worry that masturbation might worsen heart problems. For most men with stable heart health, masturbation is completely safe. It causes about the same heart rate increase as climbing a short flight of stairs. Of course, men with serious heart conditions should talk with their doctor, but few need to avoid sexual activity completely. There's also a persistent myth that older men who continue masturbating are somehow immature or stuck in adolescence. This harmful stereotype ignores the fact that sexuality is a lifelong part of human health. Just as staying physically active with age-appropriate exercise helps maintain overall health, maintaining appropriate sexual activity supports physical and emotional well-being. Do you wonder why society rarely questions older people exercising, but sometimes judges sexual activity differently? Both are natural and healthy forms of physical function. A common misunderstanding is that stopping masturbation will increase testosterone levels and sexual performance. Research actually shows the opposite effect in older men. While very young men might see a short-term spike in testosterone after abstaining for a week, men over 60 typically benefit from regular sexual activity to maintain hormone balance. The use it or lose it principle applies strongly to sexual function in older age. Some also believe that masturbation causes prostate enlargement or cancer. Current medical research suggests the opposite. Men who ejaculate more frequently throughout life may have lower risks of prostate cancer. Masturbation neither causes nor worsens prostate enlargement, which is mainly influenced by age and hormones. While regular masturbation offers many health benefits for men over 60, there are certain situations where caution or medical advice is needed. For men with certain heart conditions, especially unstable angina or recent heart attack, it's important to get medical clearance before resuming sexual activity of any kind. Sexual activity causes a temporary increase in heart rate and blood pressure, so men with poorly controlled heart issues should talk with their doctor about safe activity levels. Men taking certain medications should also be careful. Some blood pressure medications can affect sexual function, and nitrate medications for heart conditions should never be mixed with erectile dysfunction drugs. If stopping masturbation seems linked to medication timing, this connection should be discussed with a healthcare provider who might adjust dosages or switch medications. Physical pain during masturbation always calls for medical attention. Pain might signal an infection, inflammation, or other treatable condition that shouldn't be ignored. Discomfort in the genital area, testicles, or lower abdomen during or after sexual activity isn't normal and needs proper medical evaluation. Men recovering from prostate surgery or treatment should follow their surgeon's guidelines about when to resume sexual activity. While gentle masturbation eventually helps recovery by increasing blood flow to the area, timing matters. Starting too soon might cause complications, while waiting too long might slow recovery of sexual function. For men with diagnosed prostate cancer, the advice about masturbation varies based on the type of cancer and treatment plan. Some treatments affect testosterone levels, which changes how sexual activity impacts the body. A doctor's guidance is essential in these cases. Psychological factors sometimes play a role too. If a man stops masturbating due to depression, anxiety, or relationship problems, these underlying issues deserve attention. Sexual desire often reflects overall mental health, and sudden loss of interest might signal emotional concerns rather than physical ones. Have you noticed changes in your mood or outlook connected to changes in sexual interest? This connection is worth mentioning to healthcare providers. Men who take medications that affect sexual function should speak with their doctor if they notice changes after stopping masturbation. Sometimes medication side effects become more noticeable when regular sexual activity decreases. A healthcare provider might suggest adjusting dosages or trying different treatments that have less impact on sexual health. For most healthy men over 60, maintaining some level of sexual activity brings more benefits than stopping completely. The key is finding a comfortable personal balance. There's no right frequency that applies to everyone. Some men might masturbate several times weekly, while others might do so just occasionally. What matters most is maintaining the connection between mind and body and keeping those physical systems working. Regular checkups with a healthcare provider should include honest conversations about sexual health. Many men feel embarrassed to bring up these topics, but doctors who work with older patients understand that sexuality remains important throughout life. Sharing concerns about changes in sexual function often leads to helpful solutions or reassurance. Physical activity and overall health habits strongly affect sexual function at any age. Regular exercise improves blood flow, maintains muscle tone, and supports hormone balance, all factors that benefit sexual health. Even moderate walking several times weekly makes a difference in maintaining the physical capacity for sexual activity, including masturbation. A healthy diet also supports sexual function. Foods that are good for heart health are generally good for sexual health too, since both depend on good blood flow. Fruits, vegetables, whole grains, lean proteins, and healthy fats help maintain the physical systems needed for sexual response. Limiting alcohol also helps, as excessive drinking can interfere with sexual function, especially in older men. Staying sexually active, whether through masturbation or with a partner, helps maintain a positive relationship with the aging body. Men who continue some form of sexual activity often report better body image and self-confidence than those who stop completely. This psychological benefit shouldn't be overlooked, as feeling good about one's body contributes to overall happiness and quality of life. Ultimately, each man must make personal choices about sexual activity based on his health, values, and circumstances. The important thing is making these choices based on accurate information rather than myths or embarrassment. For most men in their 60s and beyond, maintaining some form of sexual activity, including masturbation, supports overall health and well-being in ways that benefit many body systems. Sexual health remains connected to general health throughout life, deserving the same thoughtful attention as nutrition, exercise, and medical care. Your experience matters. Please leave a comment to share your story or ask me a question. Thanks for watching.